Delta variant is creating such a strain on hospitals that Legacy Health is now putting a pause on all non-urgent
Now,
surgeries.
the pause will be for 2 weeks to allow for more available beds. Joining us live to explain more is Legacy Health's Brian Terrett. Good morning, Brian. Thanks for joining us.
Good morning. It's great to be here. I appreciate you having me on.
Yeah, so why this pause being put into place?
Well, there's a couple of different reasons. I think the most important thing is we look at our predicted numbers, and as you just showed in your graph, the numbers of patients that are coming in are expected to increase. Yesterday, we had 129 patients in our hospital. That's the third highest since the first of the year. It doesn't quite meet our November high of 150 patients, but at this point, if nothing changes, we anticipate having probably twice as many patients within the next 2 weeks. Kind of given those numbers, we feel like we have to make room for the ability to care for patients, not only for beds, but more importantly, the equipment that it takes to care for these patients as well as the staffing. So we unfortunately had to make the tough decision to go ahead and pause non-urgent surgeries for the next 2 weeks as we see what happens. We're hoping that within the next 2 weeks, we can start to see the surge ease, and then we can resume those non-urgent procedures.
Okay, and I'm assuming this is for hospitals in both Oregon and Washington. And if someone has a surgery scheduled, what can they expect?
So a couple of things. One, I think it's important to point out if somebody has an urgent or emergent surgery that's needed, they're going to get the care that they need. If somebody has a non-emergent or non-urgent surgery, more than likely they're going to be contacted by their provider, whoever's going to be doing the surgery, and they'll let them know that it's been paused and have to do the reschedule. If they haven't been contacted by their provider, we suggest they reach out to their provider and ask if they're affected by the pause. And there's a possibility they might not be affected. So, that's the good news for those individuals.
Okay, and when we're talking about non-urgent surgeries, I just want to clarify for folks, I think people have heard of elective surgeries before, things that they've been wanting to do but don't necessarily have an impact on their immediate health and safety. What are you distinguishing as a non-urgent surgery?
So when you think about that, the National Institutes of Health has indicated that non-urgent surgeries include things like joint replacement or hernia surgery, reconstructive surgery, things like that, where essentially it's possible for people to delay that. We do understand that if, for instance, if somebody has a joint surgery replacement scheduled, that's being done because people are in pain, and we understand that will people have to live with that. But at the same time, we feel like the need to have open beds, to have the PPE and supplies that we need, and have the staff we need is important, at least over the next 2 weeks.
If I had to pause it because of what's happening, have you heard from people who are, upset because they've been waiting for these certain surgeries? Or are they angry about this and what's happening overall?
Well, there's a couple of things. I think there are some people, obviously there are some people who will be disappointed in something like this. At the same time, when we had to do this earlier in the pandemic, people understood, that there was a greater community need, and they understood that there was a possibility that, they would be impacted by this greater community need. It's an unfortunate thing, but people understand that, as a community, we may need to pull together, and so they're willing to, let that pause.
I want to talk in general just about the strain on our healthcare systems right now. We've mentioned that healthcare officials are asking people to avoid the emergency room if there's things, smaller issues that can be dealt with in primary care or in urgent care. What do you want people to know about accessing healthcare right now, both for emergency situations and for other issues?
Absolutely. I think the most important thing is people need to understand that if if they have an emergency, there's a life-threatening emergency, they will get the care that they need, and they can be brought to an emergency department. We're still caring for those. What we're asking people to do is a couple of things. One, if it's not an emergency, there's a couple of different ways that people can access care. We would encourage them to go to their primary care physician. I can tell you that the Legacy Medical Group is still seeing patients, in the doctor's office, and to seek care there. If the need is needed sooner, then there are urgent care facilities. Legacy Go Health has urgent care centers throughout the metro area that they can go to and actually see a provider in that setting. The other thing that all hospitals are seeing right now are people are walking up to emergency departments to see if they can get COVID tested because they're concerned that they may be infected with the Delta variant. We're asking people not to come to the emergency department for a COVID test because we can't provide that kind of a test in an emergency room setting. We're doing testing in the emergency department only for patients that are going to be admitted to ensure that if they are infected, we can put the right precautions around them. And if they're not infected, we know that they can be admitted without risk. So we're asking folks if they feel like they need to be tested. There's a couple of different ways they can do that. I can tell you Legacy Go Health urgent care centers have rapid testing. At a couple of their centers, they can certainly contact Legacy Go Health and check with them. And I know that there are other locations that they can find for that kind of testing.
Yeah, I know earlier in the pandemic, I went to some Legacy Go Health urgent centers to get those tests. It was very quick and easy. Bryant Terrett from Legacy Health, thanks so much for joining us this morning.
Thank you for having me this morning. I appreciate it.
Yeah, and for more information and resources about Oregon and Washington State's hospital bed capacity, what things are looking like in our healthcare system right now, you can find the latest information anytime on coin.com.